To go now to Pope Francis's health. The Vatican now says the 88-year-old had developed pneumonia in both lungs and are canceling events as he remains hospitalized. Chief International Correspondent James Longman is at the Vatican for us this morning. Good morning, James.
Yeah, good morning, Michael. Pope Francis has now spent a fifth night in the hospital, but he's now dealing with a much more serious condition, pneumonia in both lungs, and all his appearances cancelled until at least through the weekend.
This morning, mounting concerns as Pope Francis battles pneumonia. The Vatican says the 88-year-old now has bilateral pneumonia, which is an infection in both lungs, and he needs additional drug therapy.
Some of these findings in this report, I'll have to be honest, are worrisome. If you can imagine, as the pneumonia spreads, it becomes more difficult to treat.
Concerned because of his age and history of lung complaints. As a young man, he had part of a lung removed because of a respiratory infection.
He was already being treated for bronchitis, delegating others to preside over events in his stead. Now his calendar has been cleared through Sunday as he's prescribed complete rest.
In the coming days, the most important factors that the medical team managing the Pope will be paying attention to are, number one, how is he responding to treatment?
Father James Martin, who's met with the Pope multiple times, recalls how even in sickness, the Pope encourages others.
It is amazing to me that even with a walker and a bad knee and a wheelchair, and sometimes when he's sick and not feeling well and tired, that he always has a kind word for people.
And despite these latest results, the Vatican says Pope Francis is in good spirits.
And on those good spirits, we're told by a Vatican source that he is spending at least part of the day in an armchair. So that means that he's not totally bedridden. He's also up in the morning having breakfast and reading. So that is some good news, but he's likely to be in the hospital for some time yet. Robin.
Of course, we're praying for a full recovery there, James. Thank you.